Hello viewer, welcome back to Farm Easy World. Today, we are discussing an important respiratory virus known as human metapneumovirus, shortly we called HMPV. We'll explore is that more dangerous than the COVID, and what it is, its history, how it spreads, the affected regions, precautions to take, available medicines, and everything you need to know to protect yourself and your loved ones. Human metapneumovirus is a respiratory virus that belongs to the Paramyxoviridae family, the same family as RSV. It primarily causes upper and lower respiratory infections, especially in young children, the elderly, and those with weakened immune systems. HMPV is known for causing symptoms like fever, cough, nasal congestion, and difficulty breathing, and in severe cases, it can lead to pneumonia or bronchiolitis. HMPV was first identified in 2001 by a team of researchers in the Netherlands, although studies show the virus has been circulating among humans for over 50 years. It is considered one of the leading causes of respiratory illnesses, second only to RSV and influenza in terms of its global impact. HMPV spreads in a way similar to the common cold or flu. First, direct contact, by touching an infected person or contaminated surface. Second, droplet transmission, through respiratory droplets when an infected person coughs or sneezes. Third, airborne transmission. In some cases, the virus may linger in the air, making it possible to contract without direct contact. Fourth, close proximity, spreads faster in crowded places such as schools, hospitals, public transport, and daycares. The virus tends to peak during late winter and early spring in most regions. HMPV cases have been reported worldwide, but as of now, the most affected countries include the United States, Australia, Canada, and several parts of Europe and Asia. COVID's mother country China also affected. In India, recent reports indicate a rise in respiratory illnesses, including cases suspected to be linked to HMPV. This is primarily affecting children and elderly patients. Hospitals have noted an increase in severe symptoms such as breathing difficulties, requiring oxygen therapy in some cases. Sri Lanka has seen a surge in respiratory infections during this flu season, and HMPV is suspected to be contributing. The Ministry of Health has urged citizens to follow preventive measures, especially as the country's healthcare system is under strain. HMPV symptoms can range from mild to severe. Common symptoms include runny or blocked nose, sore throat, dry or wet cough, fever or chills, shortness of breath, wheezing, fatigue and muscle pain. In severe cases, particularly in high-risk groups, HMPV can cause pneumonia, bronchiolitis, acute respiratory distress requiring hospitalization. To protect yourself and others from HMPV, follow these precautions. 1. Personal hygiene. Wash hands frequently with soap and water for at least 20 seconds. Use alcohol-based hand sanitizers when soap isn't available. 2. Avoid crowded places. During outbreaks, avoid crowded areas, especially if you are in a high-risk group. 3. Wear masks. Use face masks in public places to reduce exposure to respiratory droplets. 4. Disinfection. Regularly disinfect commonly touched surfaces such as door handles, mobile phones, and keyboards. 5. Isolate if sick. If you or your family members show symptoms of respiratory infection, avoid close contact with others until fully recovered. 6. Boost immunity. Eat a balanced diet, exercise, and get adequate sleep to strengthen your immune system. Currently, there are no specific antiviral drugs or vaccines for HMPV. Treatment focuses on relieving symptoms and supporting recovery. Symptomatic treatment are, for fever and pain, paracetamol or ibuprofen can be used to manage fever and body aches. For cough and congestion, steam inhalation or saline nasal sprays can provide relief. Over-the-counter cough syrups may be used, but consult a doctor before giving them to children. For severe cases, oxygen therapy may be required for patients with breathing difficulties. Hospitalization is necessary for complications like pneumonia. Ensure proper hydration by drinking plenty of fluids. Adequate rest is critical for recovery. Research is ongoing to develop antiviral therapies targeting HMPV. Monoclonal antibodies and potential vaccines are under study. Please remember these key points. 1. HMPV is a significant cause of respiratory infections, especially in children and vulnerable groups. 2. The virus spreads easily through contact and respiratory droplets, making hygiene and precautions vital. 3. Sri Lanka and India have both reported increased cases of respiratory infections that may be linked to HMPV. 4. There is no specific cure or vaccine, so symptom management and preventive measures are crucial. As we continue to face viral challenges like HMPV, awareness and preventive actions are our best defense. By understanding the virus and taking the right precautions, we can reduce its spread and protect those at risk. Stay informed, stay healthy, and remember to subscribe to Pharm Easy for more updates on medicines and health topics. Thank you for watching.